Welcome to the New England Journal of Medicine at the annual meeting of the European Society of Cardiology. I'm Stephen Morrissey, Executive Managing Editor, and I'm talking with Deputy Editor Jane Leopold and Editor-in-Chief Eric Rubin. We're looking at the EPIC-CAD trial, Edoxaban antithrombotic therapy for atrial fibrillation and stable coronary artery disease. This is the second study of AF we've discussed today. What was the question here, Jane?
So here, the investigators looked at a very specific patient population, and that is individuals who had both atrial fibrillation and stable coronary artery disease. So in other words, they had an indication for an oral anticoagulant, and they had an indication for an antiplatelet agent. And in this study, they asked the question of whether or not you could use the anticoagulant Edoxaban as a monotherapy versus continuing on with Edoxaban and an antiplatelet agent.
Eric, again, how did this trial work and what were the results?
Steve, the trial was performed in South Korea and enrolled patients with atrial fibrillation and stable coronary disease who received either Edoxaban alone or Edoxaban plus an antiplatelet agent, which was chosen at the discretion of the treating physician. The primary outcome was a composite of death from any cause, MI, stroke, systemic embolism, urgent revascularization, and major or clinically relevant bleeding at 12 months. More than 500 patients were randomized to each group. The primary outcome occurred in almost 7% of patients who received monotherapy and 16% of patients on dual antithrombotic treatment, a difference that was statistically significant. It was largely driven by a substantial increase in the rate of bleeding.
Jane, as Eric said, the primary outcome was driven by an increase in the rate of bleeding. How important an issue is bleeding among patients with atrial fibrillation?
And this is really one of the biggest issues that we face with patients who have atrial fibrillation and are on oral anticoagulants and antiplatelet agents, because although the overall incidence of bleeding may not be high, when it happens, it can be catastrophic. And then we end up having to take the patients off of the oral anticoagulant and the antiplatelet agent, and then they're at increased risk of either embolic events or cardiovascular events. So this is a great question, and this is one where having this information will be important. The interesting thing is that Edoxaban is not used in the US as much as the other oral anticoagulants are used, but these data are important for Edoxaban users around the world.
Jane, just to follow up on what you said about the use of Edoxaban here in the US, other agents are being used much more commonly. Can we understand anything about the use of combination agents that don't include Edoxaban in this patient population?
Yeah, that's actually a great question, especially for people who are taking care of patients who are on other oral anticoagulant agents. And in this case, we may be able to extrapolate a little bit to patients who are on Apixaban or Rivaroxaban, but whether or not this actually applies to patients who are on warfarin is unknown. So until we actually get the studies looking at these agents plus antiplatelet agents in this patient population, we won't know. The other thing to bring up is that this trial was conducted in South Korea. So whether or not all of the pharmacology will be similar in other patient populations is also unknown.
Thank you, Jane, and thank you, Eric. This study was just published at NEJM.org.